Hurricane Katrina gave us an unexpected opportunity in the face of that tragedy to recreate a healthcare system in New Orleans, a major urban city. And we really set out to do that in a more neighborhood-focused way that took into account the patients and their needs and where they were coming back. For Tulane, that was rooted in the frontline work that the students and house staff and faculty did just after Katrina in the September of '05, when we were working on the streets without power or water or any sewer, and really just doing what we could for the population. One of the places where we set up care was at Covenant House, and we turned that from basically a card table and some ice chest for some vaccines into a full-fledged neighborhood health center that now serves up to 8,000 people, doing primary care for adults and kids. And we would not have been able to do that without the significant support from the Katrina Fund, from which we received a $5 million gift that supported not only this clinic, but has helped us to expand what we're doing out to the broader community. It gave us a chance to build a model of team-based care that we are working to replicate not only in New Orleans, but that's being looked at across the country as a way to train the next generation of physicians and social workers and nurses and pharmacists, and really work in partnership with the community to create a sustainable healthcare enterprise for them. The gift, in addition to supporting our services in this neighborhood clinic, has allowed us to get a mobile medical unit, which we can take on the road and focus on those neighborhoods that have been hardest hit by Katrina, where they still have no health services even 3 years later. And so we're able to take a team of healthcare professionals out into these neighborhoods to deliver services to the community, and we're learning so much about what those needs are going to be for that community. It's serving also as an incubator for developing new sites. And finally, we've been able to use a portion of the gift from the Katrina Fund to go out into New Orleans East and develop a new clinic out there for a population of what is now 10,000 Vietnamese who have returned post-Katrina and are trying to rebuild their community but had no health services. So Tulane University was able to step in and use the support from the gift to get them started with an incubator clinic, replicating the model of what we've done so successfully here at the Covenant House site out for that community in the East, so they will have their own health center in the future.